a lot of patients that you'll see, insomnia will be a complaint. Now, in PTSD, insomnia and disturbed sleep is also a complaint. As we'll talk about more tomorrow, part of the issue has to do with the frontal cortex and the temporal cortices working together or not. And when they're not working together, the frontal executive functions that say, time to go to sleep now, may not work. And the temporal lobe parts say, I'm still wound up, I'm still stimulated, I still got things to think about, I'm still remembering that. Won't let you sleep. So one of the techniques we use to help a person with insomnia and other kind of frontal lobe pathology, but in particular, the signature use for this particular treatment is in the treatment of insomnia. It's called the frontal triangle. You find the inner canthus of either eye. You draw straight lines up into within the hairline. And if you have no hair, you wrinkle the brow and you see where the hairline used to be. That forms the base of an equilateral triangle. You find the apex of that equilateral triangle because you know the size of the base, so you're going to know the size of the sides. And the equilateral triangle will be completed by a point on the governor vessel. So you'll have 3 points, 2 within the hairline and 1 along the governor vessel. The 2 points along the base will be threaded towards the apex. The point at the apex will be threaded towards the center of the triangle, frontal triangle. You have a wrinkled brow as though there's a question behind there. No question? Okay. Any notions about frontal triangle? The next one I want to show is the temporal fan. So you know about the central sulcus that divides the frontal lobe from the parietal lobe. You know about the interhemispheric fissure that separates the right and the left lobe. What's that called on the side that separates the temporal lobe from the frontal and parietal lobes? What's it called? No. It's just called the Sylvian fissure or the lateral sulcus. So if you take the lateral sulcus, you take the brain, take the little hunk of temporal lobe and pull it down, take a little bit of frontal and parietal lobe and pull them up, you reach right in there and there's more cortex deep inside. That's the insular cortex. The insular cortex, we'll talk about more tomorrow, but that has a lot to do with processing of interoception and exteroception, inner feelings and outer sensations, along with affective pieces and cognitive stuff. But for now, we're going to talk about its role overlying the temporal region, because what takes place in the temporal region? One is audition, hearing, and what else takes place along the medial temporal area? What's there? The hippocampus. Memory. So memory, people that are having too few memories, like I'm amnestic for those events, I don't remember when I was in Iraq, I don't remember when I came to see you last week, not just from dementia, but from other kinds of amnestic situations, or people that have too many memories, that have intrusive memories, that have memories that intrude when they go into situations that are familiar to those that they were originally traumatized in, that wake them up from their sleep, that disrupt their ability to function during the day. So intrusive memories can be a real interference in the normal and healthy function of an individual. So the temporal fan is one of our ways of approaching the Sylvian fissure, the medial temporal lobe, and the deep insular cortex. We'll talk about more of that tomorrow, but I'm going to show you examples. I don't think so the way we do this, the first line, you find the apex of the ear, you go just below the apex of the ear, and you angle a needle from anterior to posterior with a 20-degree angle with the horizon and rising posteriorly. That's your first needle. Usually I don't do the second needle second. I usually do the third needle second, just to make things confusing. But it's easy to find, easier for me to find the inferior anterior aspect of the parietal boss. When you find the parietal boss, you go just below it and in front of it. That's where the start of the third line is. So you take the first line, take the third line, make it parallel. Now you've got 2 lines. For the second line, you just split the distance between the 1 and the 3. So you can see, back one. You can see the first one. This is by the boss, the parietal boss, just below and in front of, but they're all parallel. The third needle, which is called number 2, but is when I put in third, it just splits the space between 1 and 3. Temporal fan. for memories. Too few, too many. 40 millimeter used for all these, yeah. And these get threaded all the way. Again, because you're near the masseter and not masseter, near the temporalis muscle, you want to make sure that you're not deep in the muscle. Questions? Temporal fans are bilateral. Frontal triangle, by definition, is bilateral. Yeah, I tend to use these bilateral, and they're very useful for people that have, nightmares. They're waking up with screaming nightmares. If you tend to do these a few times in a row, they really will diminish. Sometimes even after the first time. Well, it depends. Like these are rarely standalone treatments. These are usually part of. There's doing body work. There's doing ear work. There's scalp work. So there's a lot of things going on. So I would typically bring people back. If it's acute, I might bring them back a couple times in a week. If it's subacute to chronic, I'd see them every couple of weeks for a handful of visits, and then see how well I could stretch out the time in between visits. Same as what we've talked about the scalp treatments.
This has been one of our most successful developments, along with the ATP. Commonly, I'll use this with ATP. If I've got somebody who's living in the purgatory of post-traumatic stress and is really not functioning well in life, when I find out what the biggest problems are, usually it's a combination of inability to focus, inability to think, concentrate, or do any productive work, along with the torment of what did or didn't happen in prior lifetime. The combination, therefore, in collaboration with ATP, can be a real lifesaver and pull them out of this hopelessness of, is this the way I'm going to be for the rest of my life? It's not quite as dramatically successful with traumatic brain injury, which takes even more configurations than post-traumatic stress. But it certainly is a reasonable combination to include in what else you're doing with your patient. We'll talk more about other triangulations using points on the scalp to address the damage of the interior organs. We had one special ops PA that was trained and eagerly embraced the CSA. And because he wanted his crew to be clean while they were deployed, he would not, unlike his colleagues, would not give out, hold his hand out full of Ambien every time a mission was completed, so that they could get some sleep during the daytime. He said, nope. Either you go to the gym, you work out, have whatever, Jack or beer you smuggled in and go to sleep on your own, or come and get a frontal triangle. He had everyone off the Ambien and most people off the booze while they were on active deployment and dealing with their missions. Quite an amazing accomplishment. He was equally successful using one of our body techniques called the Mega Mushu for pumping them up rather than using Provigil when going out on a mission. So with the proper leadership, the proper dedication, and the proper firm management, you can accomplish truly remarkable things in the field.
So temporal fan. So the apex of the ear can be identified by saying, well, there's the apex of the ear. Let's just go below it. But for those that really like to fold ears, you can fold the ears and you can see the apex and just go below it right there. That's your starting point. Starting point, this is the oblique technique. That's one.
That was fine.
Thank you, Joe.
That was fine. No, that's the most dangerous point, because you've got your thickest temporalis there. That's the point that tends to
Great.
Win a patient or lose a patient.
We haven't lost him yet. This is the parietal boss, posterior, anterior. Here's the anterior, inferior aspect of it. So you go just below. Again, it's the surface technique, same angle. And the third one,
That was slightly less comfortable, but nothing that I would say top, back it out.
that was closer to his parietal territory. Now this one just splits the zone in between, and they're all in parallel to one another. Torque, insertion, control of the flesh and the needle and the patient. Let's get a little deeper. How's that one?
That was fine. That was
This is the temporal fan. 3 needles overlying the lateral sulcus, affecting the temporal lobe, the medial temporal lobe, affecting the insular cortex, affecting memory especially. Too many or too few. The back, A to P, 20-degree orientation to the horizon. So the frontal triangle is another lovely technique. I find this very helpful for sleep problems. So for this, you find the inner canthus, and you go straight back. Wrinkle your forehead. This is where the hairline would be. You could make a little dent right there.
You're allowed to say was. I won't be offended.
Here's the base of my triangle, okay? So I'm now going to take a needle, and I'm going to insert it towards the apex of where that triangle would be.
That one was slightly more uncomfortable than a basic scalp needle, but again, nothing that would distress me.
That one. Didn't look very straight, does it?
No, that one's way off. That's why it hurt.
Okay. Sleepy guy. Okay, now we've got a narrower triangle. So the apex is going to be up here. And from the apex is going to go to the center of the triangle. Right along the W line. I did not get these at the angle that I'd like. That's better, sorry. That's better. Frontal triangle. Not the most triangular I've ever made in my life, but still a frontal triangle, covering the frontal lobes, the frontal zone, and the sleepy zone. I know. Say again? Not so much. I could have made it long, but because I made this one, I started back a little bit. There you go. Well, the left one is over the left eye. The right one's over the right eye.
You understand the goal.
Yes. Thank you very much. So in the groups now, you'll have your choices of doing a frontal triangle, a temporal fan, cerebellar balance, and hearing vertigo.
Here's one. Do it. Have your partner do something different.
Yep.
We have enough time
Want me
for
to take these out?
all four. No, I'll do one from the photograph. We have enough time for all four to be experienced at each table.
Okay.